We're on. Good morning, Facebook people. It is another Thursday and we're doing another Facebook Live today. Today's Facebook Live topic is water birth. One of my favorite topics. One of my favorite ways of birthing. I've attended many water births over my years as a midwife, including my own. So today we're going to talk a little bit about why we love it, what the research, what minimal research tells us, and client experiences, as well as kind of how to do it. So we'll start talking a little bit about the research that's done. So in order for really good research to be able to be done, you need to have important study pieces in place, which is really hard when talking about water birth. So what we know about water birth comes from audits. And what that means is looking back over records of babies born in the water to look at levels of complications, tears, all of that, all of the outcomes we're trying to find. So what we do know about the audits that have been done on water birth is that water birth shows to decrease your risk of tearing, decrease your risk of postpartum hemorrhage, decrease the requests for pain management and epidurals, which can keep complications lower, increase comfort level for women, and it can make things sometimes a little bit faster. When we're in nice warm water and our bellies are covered in the water, then our body can use its oxytocin. There's more circulating oxytocin, which is what helps us have good, strong contractions. And it helps us to get rid of some of that adrenaline that makes us kind of afraid and worked up, and helps to promote the endorphin, which helps us to relax. When we talk about water birth, one of the things I like to share with women is if you think about what you do when you're feeling crummy, whether you're coming down with a flu or you've had a long day at work or your muscles are sore from a good workout, what are the things that you do to help relax you? And most people will say, I soak in the bath. So this is a really great place to have your baby. What we love about water birth is that it allows women to find a whole lot of different positions in the tub, and we'll go through those a little bit later. It allows birthing people to be together in the tub. It can help to increase comfort for sure, and it helps the transition really well for the baby. So baby goes from a nice warm, wet environment to another warm, wet environment. And we know that it's safe and that babies aren't going to drown because they don't have that reflex to breathe until after they come out of the water and hit the air. So when they come out, apparently you can leave a baby floating in the water for 10 minutes. Although I've never tried that. Most women, when they birth their babies, really want to hold them and see them. And so the recommendation is that, baby gets birthed into water, comes right up onto mom and stays nice and warm in the tub. Babies do have a dive reflex also that they maintain for quite a little while after they're born, where the stimulation of the air, they can swallow water into their bellies without breathing it into their lungs. And they do quite well coming out of the water. What I find about babies born in the water, though, is often they're a little bit slower to come around. They might not cry right away. They might not be overly bothered about being born. And so oftentimes when they come out, they open their eyes, they're lazily looking around, they're breathing quietly. Sometimes it takes them a little longer to get nice and pink, or it might take them longer to get that good lusty cry, but generally they do really, really well in the water. So there are safe ways to have water births and unsafe ways to have water births. So we're going to talk about how to keep your body safe from other bacteria. So that's a really, really important thing to think of when you're choosing water birth. If you're choosing to birth in your bathtub at home, a couple things to look out for at home. You want to have a bath that's deep enough. One of the benefits of water birth is buoyancy in the water. So having your belly covered by the water completely. So a standard tub isn't really fun for anyone, for any kind of bath, especially for water birth, and it's not often wide enough. But some of the newer tubs are often wider and deeper, and so if you feel like you can get in and have your belly covered in the water, that's ideal. You also want to make sure that if you're changing positions in your tub, that you're actually staying in the water. So dangerous part of water birth is if you kind of half birth your baby out of the water and then back in the water. That's not a good thing because your baby will be stimulated to breathe already. And so you want to make sure you can stay in the water the whole time. For bacteria at home, you want to make sure that whatever you're using, if you're using your own bathtub, that it's nice and clean. So take out all the bath toys. If you've got other kids, bath mats that are on the floor of the tub, give it a good scrub. You can wash it with a bleach solution, so half a cup of bleach to a gallon of water. Scrub the tub, rinse it really well, and then before you start filling it, and same with a birth pool, always run the water for at least 3 minutes through the pipes, and this will help to decrease your risk of Legionnaire's disease, which is a bacteria that's found kind of in stagnant water, and it can sit in your pipes. And so you want to rinse all of that out, and then fill up your tub. When you're using a birth pool, the other thing about bathtubs at home, if you have jets in your bathtub, you want to be really careful. So jets that recirculate the water are likely to have some pretty gunky stuff. If you think of what happens in bathtubs, you lose some layers of skin, and you're soaking them a long time. So you can use a cleaning solution to run through the jets, but ideally you can also get like a disposable liner that can go in your bathtub at home if you've got jets. There are certainly birth pools that have jets in birth pool places, like in the birth center, but their jets are specially made so that there isn't any of that circulating water, and they're cleaned very, very well. So birth pool. So if you choose a birth pool, even if you have a nice deep tub at home but it has jets and you want to use a birth pool instead, this is the birth pool we recommend. So this is the Passage Pool. A really nice thing about the Passage Pool is that it's Canadian made, and it was thought of by a fantastic midwife, Noreen, in Alberta. She had started a practice in Alberta called Passages Midwifery, and thought of the idea of this beautiful tub. So we really, really like this tub, and I'm going to just go through some of its features. So it's a smallish tub in that, which is good. It can fit in a decent amount of space, because what you want to make sure when you're setting your birth pool up at home, you don't need a lot of space, but you want to be able to make sure that somebody can get around the pool from all sides, so that we can have access. In case you adopt a position, we want to be able to kind of help to be able, in emergency situations, or to catch your baby. So find a good spot for it. The other benefits of this Passage Pool, so the size is good, its height is really nice, so women can get in, be completely buoyant. So if you're in here with full water, the water's going to come up past your belly, and it's got nice solid sides, so you can lean and take lots of different positions. My favorite thing about the Passage Pool is the fact that the bottom 2 rungs of this Passage Pool, you can see here, are see-through. This is beautiful. I didn't realize it the first time I attended a birth with the Passage Pool, and I had put my phone down with the light on, and the light shone through the side, and the baby was born into the light. It was just beautiful. It would have been really, really great had there been a photographer there or a video. But it also allows us as care providers to be able to check on progress, give encouragement, get a different perspective, so that we're not having to kind of bother you and have you move around too much. So when you're setting your birth pool up at home, we always recommend when you bring it home, when you pick it up, we sell them. The other good thing about Passages is that they're not very expensive. And the reason why Noreen wanted to develop this pool was so that all women had an affordable birthing choice to be able to birth in the way and kind of help control some of those birthing options. So we sell them at the office here. You can come pick them up. We recommend that when you pick it up, you take it home and take it for a dry run. Not meaning fill it up, but at least blow it up. Make sure you have all the important pieces that you need to get it together, so that you're not, or your partner is not, rushing around trying to fill it up while you're having a baby. It has happened many a time that the birth pool wasn't ready, and that women who were hoping for a water birth couldn't get it because there's too many little glitches. So doing a dry run is really great, getting all of your equipment ready and set up. So blowing it up is really easy. We did a time-lapse video that we'll share on our Facebook page. You just need a regular pump that you can get from Canadian Tire. Follow the instructions on the box. So on the box it says, in the time-lapse video I was a little bit wrong, I didn't read the instructions, but you're supposed to fill the bottom up. So the bottom of this pool is nice. It's got a nice cushion, airy cushion in it, and then you fill it up from the bottom rungs up. You want to make sure it's full but not overfull, because you don't want to explode the tub. So make sure that it can blow up easily, and then you can deflate it, put it back in the box, or keep it filled up, as long as there aren't going to be people or animals climbing in and out of it between the time that you blow it up and the time you get in to birth it. You want to make sure it stays nice and clean. When you're actually setting it up for a birth, set it up in the place where you feel you most want to birth, and make sure there's the room on the sides. We're going to be looking for a space to set up our baby station where it's nice, where we can have our warmer, and we want to be close to the tub if possible. So keep that in mind. You want to make sure you have lots of towels around, and you want to make sure you're kind of protecting your floors. I think one of the common questions that people ask me is, well, can my floor handle the weight of a birthing pool? Like, what if I live in an old house, and are the floor joists going to be strong enough? If you can host a party with 7 to 10 adults in wherever you're going to birth at one point in time, you can definitely put a birth pool in. So we recommend a tarp on the floor. So the tarp will go on the floor underneath the birth tub, and that's just to protect your floor. If you've got yoga mats or a carpet that you're not too crazy about and can get wet, then you can put that under the pool too, just to give you some added comfort on the floor. And then for the other equipment you need hoses to be able to fill your pool up. So you want to have 2 hoses.
Longer than those ones.
Much longer than these ones. These, unless your water attachment's really close by. It's also something to consider when you're choosing on where you're going to have your birth, is how close to a water outlet is it? And the other thing you want to know is, can your hose attach on to whatever water you're using? So you want to make sure you have the right fixtures to be able to attach the hose to wherever the water is coming out, and that your hose is long enough to be able to reach the pool. The other thing to think of is when you empty the pool and that water is getting pumped out, where can it go? So often I say pump it outside into your garden or onto your lawn. So if you're close to a window, that would be easy to do.
You can pump it into the toilet as well.
You can also pump it into the toilet or bathtub, like your own bathtub, or laundry tub. Lots of different options. I like pumping it outside because it helps to give good nutrients if there's blood in the water, for sure. So you want to remember, when you're hooking your hose up, you want to run hot water through your hose for 3 minutes. Again, that's the Legionnaire's piece, and making sure that there's nothing that's been sitting in the hoses. You should use a brand new hose for the clean water. And for the dirty water, because you don't want like a garden hose that has gardeny stuff that's going to be in your pool. So with the clean hoses, you still want to rinse them out, rinse them with hot water for 3 minutes, and then start filling your tub. One of the things that most people will run into when filling up their tubs for water birth is the size of their water heater and whether or not they have enough hot water. So I always recommend start filling the tub up only with hot water. You'll drain your water heater, and then the water will turn cold and it will mix itself in. You want to make sure you're not overfilling your tub. So if you're filling it with no one in there, which is ideal, make sure you're not filling it too high so that when the laboring person is getting into the tub, it's not overflowing all over your floor, because that has also happened. So you want to fill it up. You want the temperature of the tub of the water to be between 34 and 38 degrees Celsius. So that's the ideal temperature for birthing. Over 38 degrees is a little bit too hot, so that's about 100 degrees Fahrenheit. And so we want to make sure that you and your baby are safe. It should still be comfortable for you to be in. So you do want it can be warm, you just don't want it to be too hot. So getting a thermometer that you can use in the water, a submergible thermometer. Most thermometers, most regular oral thermometers can actually work too, just to be able to get a sense of the water temperature. You also are likely, depending on how long your labor is, you're likely to maybe need to take water out to put more hot water in or alter the temperature somehow. So that's why you have your dirty hose. You can pump water out or take water out with the dirty hose and then put some more back in with the clean hose. And that's why you need to keep them separate with well labeled, clean versus dirty. So you fill it up. Now, actually birthing in the water is really, really fantastic for pain relief. And sometimes what happens is, if you're not in active labor yet and you're just in early labor and you climb into the birth pool, your contractions might slow down and go away and you might get a break. Yay, that's great if you want to have a break. But if you want to have your baby, it's great to wait until you're in a really good kind of active labor pattern, the contractions are good and regular and strong and things are changing. That's the best time to get into the tub. It's a tool for pain relief. So if you're coping really well out of the tub, then keep coping really well out of the tub and use it. You can use it as a tool because it is quite a relief. A lot of women will say it's quite a relief for getting in to change just change the environment and change that coping piece to be able to get in. So you're going to get into the tub when you feel like it. Empty your bladder beforehand. Maybe sit on the toilet for a little while, see if you can empty anything else before you get in.
Jean is flashing hearts at you.
He's
watching.
My husband is watching. He filled up the tub I was trying to figure out how to fill it up because I didn't fill my own tubs or empty my own tubs. My husband did it all for me and my son, which was great. So you're going to get in. The really nice thing about this particular pool, and birth pools especially compared to bathtubs, is the ability to take on different positions in the tub. So a lot of women, when they're in labor, kind of instinctively will want to be in hands and knees. And so this is really great because it's a good enough height that you can be in hands and knees. This will be full of water, so not unstable like this is now. So it's a really good position to be in hands and knees. It helps us to open our hips more, and the water should be deep enough so that our hips are still underwater. It's also a really great way to position to birth in. Other positions that you can take are really efficient birth, kind of more on your back. You can put your feet against the side of the tub. You can even have your partner in here in the tub with you if you'd like. It's not as roomy as some birth tubs, but this will allow for restful positions for some women. So you can put your head back, you can snooze between contractions, which is always really nice. And then you can also be in a sideline position. So there is still enough room to be on your side. We know it's better on your side. It won't compress your pelvis when you're birthing. And you can use the side of the pool to lift your leg up to help support your leg if you're pushing and birthing on your side. So lots of freedom of movement. Some women even just, kind of sit in the middle of the pool and chat with people around them while they're having their baby in between the contractions. And then I would always say make sure you've got some big pots of hot water on the stove, boiling on the stove, because usually we do have to add in some extra hot water to be able to keep the temperature up, depending again on how long you're in here for. So then you have your baby comes out, it's lovely, your baby gets to come skin to skin on you in here. Nothing changes whether you're in the water versus on the bed or on the land, kind of land birth versus water birth, as far as that immediate postpartum. So we still want baby to come up skin to skin with you. Some women will deliver their placentas in the tub, some will deliver them out of the tub. And then again, that baby might take a little bit of time to come around and to open their eyes, but we're quick to check and we take good listens to your baby, and we're following kind of the same monitoring principles for the birthing person and the baby through the whole labor and early postpartum. We are trained as midwives to be able to also kind of calculate blood loss in the water. So, and I like to look at it like from a wine basis. So we know kind of what's safe as far as the color of the water and how much blood there is in it, because we know everybody bleeds after they have a baby. And so there are there's some extra training that we've had for water birth that helps us to determine amount of blood loss and what's safe and when to get you out. So once you're ready and feel strong, we're going to get lots of help to get you out of the tub. Most women will feel well enough to be able to stand up, get their leg over the side. Usually you're holding your baby with you at the same time. And then somebody else should deal with the pool afterwards. Laboring mamas or new mamas get to cuddle their babies while partners, not midwives, partners or other people empty the tub. So best way to empty the tub and safest way to empty the tub is with a submersible pump. So here's a submersible pump that we use. There's a filter on the bottom. So this goes on the bottom, and then it will pump the water out, and you hook up a hose to the other end, and that's where you're going to be dumping either into your shower, bathtub, toilet, or outside.
So sorry, Becca, so you would put the dirty hose on?
The dirty hose, yeah. So the dirty hose goes on this end to be able to shoot the water out. And then this end is what goes in the water, and it's got a filter on the bottom. There are special cleaning instructions for the pump to be able to clean it for further use. This is the one thing about the passage pool is it's a single-use pool. So it can be used for your family. It's not recommended that you share it around. If you've rented a pool or you're borrowing somebody else's pool, make sure you get a disposable liner. So there are liners that are made for birth pools like this that fit right in. It's like a big clear garbage bag. that fits right in and gets pulled over the sides, that you're not worried about contamination at all. If you plan on using it again for yourself, which most women who have had water births will do it again, then you can give it a good clean, again using like a cleaning solution, rinsing it out, and then a bleach solution and then let the pool dry completely before folding it back up and trying to put it back in the box, which, as we all know, is very, very hard to do. And then the pool can be taken down, used as a kiddie pool if you're not going to have any more kids. Can be pretty useful afterwards. The really great thing about water birth is we're seeing it more and more often, and so Kingston Midwives have done a whole lot of work to get water birth into their hospital. So they started doing water births in pools like this in the hospital, but very, very recently, I think it was 2 days ago, they got their permanent birthing tubs in with a really great quote, and I'm just going to read it from the head of obstetrics, Dr. Graham Smith. "The tubs bring us to the standard of care as water immersion during labor has been shown to decrease the request for pain medication and epidurals, which increases a woman's opportunities to have a focused care during her labor." Lovely. So, if you guys have any questions about water birth, we're always here to answer it. I think most common questions would be, is my baby going to drown? And again, we talked about the diving reflex. And what about the cord? So, we don't do anything different whether your baby's born on land or in the water. Generally, we'll cut and clamp the baby's cord if the baby needs extra help, or if it's easier to do that to get you out of the water. But nothing else really changes. So things to remember and keep in mind is making sure that you're cleaning everything well, that you're following the recommendations, clearing water through your pipes or through your hoses, and climb in. It's water birth is just a really beautiful thing. I really, really like it. And watching babies be born through these passage pools through the side is a really, really, really special thing too. I really like that. Becky, is there anything else we need to add?
I think we covered it all.
All right.
Awesome job, Becca.
And she wants to have another baby.
Okay. Actually. The other thing you might need, fishnets.
Oh yes.
So why do I need fishnets? Well, a lot of women will poop while they're birthing, and that's okay. So fishnets help us be able to kind of clear the debris out really quickly, and hopefully there's time to change the water if needed. What else do you need? Towels, mirror if you want to watch the birth. You can put a mirror on the floor of the pool if you're on hands and knees. Sometimes you can catch that baby coming out. And towels and receiving blankets always close by, because we'll put a receiving blanket over the baby, and we want you to be nice and warm when you get out of the pool, because warmth is what helps with that oxytocin. So getting out of the pool, we're going to keep you and your baby nice and warm, and then get you settled on a nearby couch bed to be able to finish the rest of our care.
Awesome.
All right.
Thanks so much for watching, guys. Thanks, Becca.
Thanks. Have a great day.